I'm Dr. Tim Pehl. I'm a family medicine doctor. I've been here at Grand Itasca for my entire career, which started in 2001. I take care of children, I take care of grown-ups, I take care of elderly people, and I really enjoy what I do. So heart health is extremely important because it's the second leading cause of death in our country right now. There are some components to it that can be hereditary or genetic. There are also some components that are based on the way you live your life. We tend to focus more on the modifiable risk factors, we call them, which would be exercise, diet, not smoking. So a heart-healthy diet would be very high in fruits and vegetables, particularly high fiber. There are two types of fiber, and the kind that's in oatmeal that gets really thick when you add water to it can reduce your cholesterol levels in your blood by pulling out the building blocks for cholesterol. We recommend typically limited amounts of red meat and more oily fish. Salmon, for instance, sardines, mackerel. All fish is for the most part, pretty good for you, but especially the oily fishes. And then lean chicken and turkey. Probably the biggest lifestyle change is from an exercise standpoint. The recommendations are to try to get 150 minutes a week of vigorous exercise. That will greatly reduce your risk of heart disease. We recommend coming in once a year for a routine annual wellness check. We typically check your blood pressure, and high blood pressure is a risk factor for heart disease. We often will check your cholesterol levels. That will give us an idea if you're at risk for a heart attack at a young age. And then we spend a fair amount of time based on those risk factors and also based on your age. We'll spend a fair amount of time talking about healthy lifestyle, eating well, exercising, not smoking. So there are some medicines that can be used, particularly if you have high cholesterol or if you have other risk factors along with even slightly elevated cholesterol. If you have high blood pressure, often people will have to be on medicines in addition to lifestyle changes to bring their blood pressure down to a healthy range. Some of the classic signs are left-sided chest pain, pressure. Sometimes it'll go into your shoulder, it'll go up into your neck. You might feel sweaty, you might feel sick to your stomach. A lot of times people will say that the pain gets worse when they're doing an activity, and then it settles down or stops when they stop doing the activity. That's definitely something that you should see a doctor about. So if you're having heavy weight on your chest, if you're having moderate or severe chest pain, if you feel like you're about to pass out, if you've had a history of a heart attack, those are all signs that you might be having a heart attack right now. We prefer that you call 911 versus simply just driving into the emergency room, simply because the paramedics can do some treatments right away. The ambulance does much more than just transport you. And I don't know that people always realize that, because they start care, they start interventions right away. And sometimes it's as simple as just starting an aspirin, checking your blood pressure, but they can also now do some electrical tracings of your heart right away on the scene, and then they call ahead to the emergency room, so the emergency room is more prepared when you do show up with your heart attack. And we especially don't want you to drive your own car. Grand Itasca Clinic and Hospital, your partner in health.